Today we're launching the Western Sydney model of our Right Care First Time Where You Live program, supported by the BHP Foundation. This is a further development of our model, as we've done over the last 2 years in the ACT, in Brisbane South, and now in Western Sydney. This particular model has some important new elements: a differentiation from distress in general from mental disorder. It has some critical insights about what will really make a difference in health services, in new interventions, and in the wider society. It tells us things we haven't been able to look at before.
It's been fascinating, absolutely thrilling to see a very practical way that we can measure and project the impact that we can have with our funding, our commissioning and procurement processes, and see some very targeted impacts to the youth mental health.
Unpacking the systems modelling from today's workshop was really amazing to see just how vast the impact the interventions that we have mapped out can have, and what that looks like when you are looking at how things are going to expand and grow in the future.
Main insights are this tool really gives some data and evidence to support making decisions around where we base our mental health interventions and the impact of those interventions on the population.
It just takes the guessing out of it. It just provides clarity for us to see the impact it can have, where our money is best spent to see the impacts that we need. I think so often we try and guess, and there are so many voices in a room, and often it's the loudest voice that gets the funding, whereas this takes that element out of it and allows us to be very targeted in our approach.
The best part of this experience was the approach that we had, the participatory approach, engaging different stakeholders from different sectors in different levels, and also engaging youth in this project, not just in when the model is done and developed, but through the model development. And it shows the value of this modeling not as a product, but as a change management procedure instead of just a product as a tool. It shows the importance of participation and engagement in developing the model.
I think having lived experience is a necessary contribution, quite frankly, because in order to create a program that is effective in targeting the types of issues that young people experience, you need to be listening to young people and listening to what their experiences are and what they believe the needs are for that community.
I think the use of lived experience is to look over things in the model to see how things ultimately play out, and to kind of bring that sense that this is something that could have improved my experience or other people's experience, and hopefully can do that in the future.
In terms of where I think I'm going to take this advocacy, I would really love to unpack some of the systems modelling and user modelling, user tools, to better understand the tool so that I can take it to my other advisory groups, the Western Sydney Youth Council and the New South Wales Mental Health Youth Advisory Group, to say, here's the research that has been conducted, and this is the impact that it could potentially have if we were to actually apply this in real life applications.
I think, yes, West will be the custodian of this tool, but it is just a leverage for us to further collaborate, to further engage. It's the impact that it can have is limited by if only one of us picks it up. The more of us who pick up and engage this, the impact that we can have in this area will only increase. And I think it's certainly a mandate for us, for my team, to make sure this doesn't sit on a shelf and get dusty, but that it's engaged in our business as usual processes, and that we continue talking about it, using it, and engaging with other users of the tool so that we can continue to learn from each other.